Welcome to America. What do we want to crash out about today? I'm going to crash out about the scam of corporate health insurance because I have notes. Want to join? I have corporate health insurance. Scott has corporate health insurance. He works for a large organization, $1 billion organization. They offer at open enrollment different tiers of coverage of healthcare. Okay. We always select the top tier, meaning the most coming out of his paycheck every 2 weeks, because I'm chronically ill. Our son's chronically ill. We want to pay the least amount when we go to point of service, because the premium covers it, right? Fucking wrong. Scott needs surgery. Not like an elective, this can wait, like, we'll see. He needs it. He has a polyp inside of his sinus cavity that is so big that it is blocking any postnasal drip. It's going down into his chest. He's getting chest infections over and over again. He can't smell, he can't taste. It needs to be done. So we're close to the end of the year. I'm like, oh, well, we should have definitely met our deductible. This is going to be covered, right? Wrong. The surgeon who's in network gives us our cost after insurance. It's going all towards the deductible that hasn't been met yet, even though that's $1,500. Our deductible is like $2,000. I'm like, okay, well, great. Then at least we've almost met it. And he's like, but you have to call the anesthesiologist and also the surgery center for their costs. I'm like, you couldn't give me all in one price? No, just call these places. I call the anesthesiologist. That's in network as well. The rest of the $500 is going towards our deductible. Good. We have met our deductible. Everything should be covered from now on, right? Wrong. Call the surgery center. The surgery center gives me a price. I'm like, that's not right. We've met our deductible. They're like, we're out of network. I'm like, why is an in-network surgeon performing surgery at an out-of-network surgery center? That can't be right. She's like, it is right. Here's your price, about $1,800. I'm like, what is that going towards? It's going towards your out-of-pocket. You're paying 20%. I'm like, what if I want to pay cash? And she's like, you can't pay cash. And I'm like, I can pay cash. I have the cash. I want to pay cash. She's like, you're not a cash pay patient. And I'm like, I want to be a cash pay patient. And she's like, well, we know you have insurance, so we have to run it through the insurance. If we don't, we could lose our contract with that insurance. I'm like, well, you're out of network. It's not that great of a contract anyways. Like, just do me we can't. We have to run it through the insurance. And I go, humor me. Entertain me. Just for shits and fucking giggles. He loses a job. Tomorrow I call back. I am a cash money 99 patient. How much are you costing? How much is this cost? What is the price? And she sits there in silence, and I sit there in silence for about 25 seconds. And she says in a quiet voice, she goes, it would be significantly less. I go, significantly less? Why? Because you would be a cash pay patient. We give a discount for cash pay patients. We give a discount for... So when open enrollment comes next month and the prices are astronomically higher because the big fucking beautiful bill and all that fucking garbage, cancel it. Cancel it, and all that money that we pay per pay period goes into a high yield savings account, and then we'll use that because fuck corporate health insurance.